Changes are coming to how people in our region can access GLP-1s. A new program is expanding access to the drug for Medicare recipients.
But as access is expanded at the federal level, the UVM Health Network is cutting access to the drug for its employees and their dependents. Our Alexis Crandall is live in the newsroom with more on the impact this could have for some people. Alexis.
This change only applies to coverage if someone is using a GLP-1 for weight loss. Diabetes treatment will still be covered. The health network says it will save millions of dollars and limit future increases in premiums. But people I spoke with who are currently using GLP-1s are worried about the long-term impacts. The University of Vermont Health Network is dropping coverage for employees using GLP-1s for weight loss starting in September. Haley Duquette and Michael Popovich are two employees losing access. When their employer switched healthcare providers, they were told they would still be able to access the medications.
They said there might be some restrictions on people newly starting them or our dependents starting them, but not people that were already on them. And I wholeheartedly believed them, so I felt really angry at first. And then reading the whole communication from them, they talked about how they would help us find weight loss counseling and things like that, and they just make it sound like it's all vanity.
Both say they have seen firsthand how the drugs can improve people's lives and worry what will happen to people who won't be able to afford them when the rule change goes into effect on September 1st.
All of my colleagues in the hospital and the struggles that some of those folks have, and it's not just about diabetes. It's folks that have genetic predispositions to different things like heart disease and obesity and even in some cases addiction.
In a statement, University of Vermont Health said use of the medication has increased significantly over the last 2 years, and the cost is one of the fastest growing drivers of health plan spending. Continuing to offer the medications would put pressure on premiums and the sustainability of the health plan. Their changes come as a federal program is expanding access to GLP-1s for some Medicare recipients. As of Wednesday, the Medicare GLP-1 Bridge program allows eligible Part D enrollees to pay just $50 a month for Foundayo, Wegovy, and Zepbound. The pilot program only applies to Medicare.
For those on Medicaid, nothing is changing. Vermont Medicaid currently covers GLP-1 medications only for FDA-approved indications that are included under the Medicaid pharmacy benefit, such as type 2 diabetes, sleep apnea, and certain cardiovascular risk reduction indications. Vermont Medicaid does not currently provide coverage for GLP-1 medications when prescribed solely for weight loss.
Vermont Medicaid says they recognize that GLP-1 medications can help with weight management, but right now covering the drugs would strain the budget and require changes to the state Medicaid plan.